So neurosurgery is actually surprisingly simple. Anything in the brain can cause symptoms in only one of a handful of ways. Firstly, it can be discovered because you have a scan for another reason altogether. And we see that a lot now. So we're increasingly seeing patients who've had a scan for a completely unrelated lesion, who find a lump or a bump inside the brain that's not been diagnosed before. And that's called an incidental finding. And seeing a neurosurgeon in that context is often very reassuring for the patient, because a neurosurgeon who specializes in brain tumors is often, 9 times out of 10, able to reassure the patient that actually this is a variation of normal, effectively like some people being taller or shorter than others, and allows them to calm the situation down and put forward a plan of action that often just involves having a scan every once in a while and seeing the surgeon. That's called an incidental finding of a brain tumor. Another presentation would be with symptoms of what are called raised intracranial pressure, so in other words, pressure building up within the brain. And the reason that occurs is because the brain is enclosed inside a box, which is the skull, which can't expand. So you have another lump inside there growing, it's going to cause pressure on the brain. And those symptoms are the classic symptoms that patients think about when they think about a headache, so when they think about a brain tumor. So symptoms such as headache, problems with vision, if it's left untreated, sickness, vomiting, and drowsiness. It's very unusual these days to see a patient who presents in such extremis, but certainly headaches can be a presentation of brain tumours, though I want to reassure people that the vast majority of patients who have headaches don't have a brain tumour. The third way that somebody can present with a brain tumour is epilepsy or fits. In other words, the tumour causes irritation of the brain and causes abnormal electrical activity that causes a fit, either manifesting as a generalized convulsion, so the classic fit where somebody passes out, the whole body shakes, or where they lose the ability to move a limb or talk or feel slightly out of their environment and a bit detached. Those can all be manifestations of brain tumours, and often the type of fit or seizure can give you a clue as to where the tumour may be. And finally, brain tumours can present by causing pressure on the brain and producing a weakness in a particular part of the body. So difficulty with speaking, difficulty with moving one side of the face, difficulty moving the arm or the leg. And we see this very often as patients who've had a scan because they're thought to have had a stroke or a mini stroke, but unfortunately the actual diagnosis is a brain tumour.